I rise this morning to join you in thanksgiving for all that we have done in this state to secure excellent health care and healthcare systems for everyone. But I also rise in recognition of the challenge that remains before us and the need to spark bold action on behalf of excellent health and healthcare for people everywhere. Now, I rise not as an expert on the policies, on medical technologies, on hospital organization, on doctors' concerns, on business models, on Affordable Health Care Act, or any kind of system for and solution to disease and despair. But rather, I rise, like many of you in this room and outside this room, as a layperson who wants and needs affordable health care and the peace of mind it brings to know that we have it so we can get on with the big dreams that we have in our lives, whether we are teachers, social workers, laborers, community leaders, healthcare advocates. All of us have big dreams in our hearts and minds, and we need to have the peace of mind to know that we can get on with our work, and that if a serious illness, God forbid, should strike, we will be taken care of well without going into bankruptcy. Let's face it, some people can pay if such a situation should arise, but most people can't. Should those in the latter situation defer their dreams because of a bad or shaky healthcare system that won't attend to them for lack of funds? I've been asked to join you this morning for a few minutes as we begin the work of this day to reflect on the reasons why you are here to do the hard work of what lies before us in plotting, planning, and resolving all that remains to be done in the quest for excellent, affordable health and health care. And this marvelous video that you've just seen has urged us to rise to the challenge. Let's take a moment early to think about why, so we can be charged and sparked for the bold action for the long haul that action will need in order for it to unfold and take hold. So I want to share some stories from the field. Stories that remind us both of the excellent work that has been done, but of what yet needs left undone. And to answer the question, why so bold? So, 3 stories. The first comes from the Atlantic Monthly magazine of August 2015. You might have seen this. A story about a balance bill for some $30,000. The story begins as follows. When Susan Rakowski was hired as an English instructor at SUNY Orange last year, she was elated. After several years of unemployment, she and her husband, Michael Trust, had been eating through their savings and 401ks. Better yet, the job came with good health insurance through New York's Empire Plan and United Healthcare. They signed up. And she says, I thought we were out of hot water. And they were, until Trust, walking their dog one day, felt something in his heart, shortness of breath, and he was taken to an ER. Now, here are some calculations that they had to go through in those agonizing moments. Trust and Rosowski live in Dingman's Ferry on the easternmost edge of Pennsylvania. There was an emergency room in the nearby town of Milford, but Rosowski didn't think there were network there. Another option was nearby urgent care center, but it was across the border in New Jersey, where Rosowski wasn't sure if she was covered. So she opted for the bond-secure community hospital in Port Jervis, New York, the state where the couple's insurance plan was based. They got there, and she made sure the insurance was accepted. But can you imagine the calculations in a moment of crisis? Well, Trost, after some examination, had a failed mitral valve and would require surgery. So he had to be moved to another hospital in southern New York. And again, Rosowski asked, does my insurance cover? And it did. So on April 1, his heart was operated by Arthur Negg, a cardiac surgeon in Hackensack, New Jersey. Trost did well. Out of the hospital a week later, and the bills a few days later started to come. A few hundred for a hospitalist, a few hundred more for urologist. Insurance pitched in. Rosowski wrote the checks for the rest. But then a surprise bill, $32,000 for the services of Dr. Negg, and the insurance was going to pay $4,000. What happened? The couple, the article says, had encountered what's known as a balance bill. The term for such a situation, many of you in the audience might know, in which an entire hospital stay or procedure is covered by insurance, but one of the specialists involved is out of network and bills the patient separately. Now, for me, the key in this story is the following. Rosowski says, Mike's life was in jeopardy. There was little time to think rationally. It would never have occurred to me to ask every individual, are you in my network? Now, these are resourceful people, a professor, her spouse, and they started calling, writing, and they found out that New York had a state that protected them against such situations. And in fact, the article says the following. In the New York City metro area, there are hundreds of thousands of people who commute across the tri-state area of New York, New Jersey, and Connecticut, said Chuck Bell, program director for Consumers Union. Thank God for you policy wonks who know these things. And Chuck is here. All right, so you know this story better than I do. Ultimately, these varying state laws and regulations can be extremely confusing. That's your quote, Chuck, wherever you are. Do you know that I'm one of those people? And I hadn't thought about this. All these years of driving back and forth from New York, I live in Connecticut, travel to New York, sometimes go to speak in New Jersey. And I hadn't thought about, and I read the article 2 or 3 times, and finally it hit me. Wait a minute, this could be me. And I asked myself the question, would my wife Olga's wonderful public school district health coverage take care of me if something like this happened in New Jersey or something like that? I still don't know the answer for sure, but all along I assumed so, because my working assumption is that good health care coverage is not just good, but excellent. But the nagging question is it? Can we continue to ask and answer those kinds of questions in forums like these today? Can we take bold action to have a healthcare process that simplifies access, ensures quality, so that all are covered, not as a matter of privilege, but good common sense? What happened to our friends in Pennsylvania, New York border? A few complicated things. Their initial request for coverage was denied. They appealed to Pennsylvania State Senator Bob Casey. They appealed to the New York Department of Financial Services. It looks like they were caught in a quagmire. Trust operation surgery took place on March 31st, the day before his surgery, or rather, March 31st was the day when the law in New York passed that you couldn't do this kind of thing to people, that you were covered by your policy regardless of where you lived. But there were complications. Well, finally, and I'm cutting to the chase here, their claim was approved, their bill was paid, but then I read this. Professor was relieved, but then she found this about the situation. Dr. Negg's office accepted much less from United Healthcare than Dr. Negg had originally billed. And the professor asked herself, wait a minute, what's the real value then? If the surgeon accepted a lesser payment finally, when dealing with the insurance company, why did the couple get the exorbitant bill in the first place? What did that surgery really cost? Whatever price someone is willing to pay? These are also questions that we ask in forums like these as we move forward. Well, this story has a good ending, and good for them. They fought the good fight. In the end, justice prevailed. However, what a hassle. And this was a professor and her spouse. They had the wit and the time to keep on fighting their cause. Most people don't know what to do, who to call. Many might have carried their bill into bad credit and bad debt. The question I ask myself is, can't we simplify matters? Can't we clarify it? Isn't there a better way to figure out costs that are real and methods that are just and excellent for all? Those are the kinds of questions to be asked today and beyond, driven by the conviction to be fair and equitable and as simple and uncomplicated as possible for the sick so they don't get sicker, trying to get better. Now, my second story, and this one will appeal to our friend Adam, United Healthcare's social media man, a good one. Universal Healthcare, sorry, that's a big difference, thank you. Big difference. This story comes from the world of tweeting, and Francis mentioned that. A young doctoral student in Arizona tragically contracts cancer. After several months of treatment, his student healthcare policy, health insurance policy, writes to him that his eligibility is done. This is 2012. I think the laws have changed since then. He owes $118,000 for treatment, the treatment he needs to ensure survival. So what does he do? Like a good millennial, he takes to the Twitter airwaves. When he finds out about this gap in his student health care insurance, that his money is up, that the kitty is done, Arich Guha, the young man in Arizona, writes on his Twitter account, Aetna has denied $118K in claims in just 5 months since kicking me to the curb. Gotta preserve the $2 billion annual profit somehow. The insurance company took to Twitter under the name @Aetna Health and asked Mr. Guha to contact someone. And his moniker, because of his illness, was @PoopStrong. And he writes, and they wrote to him, we care about our members. We want you to be empowered to be healthy and make informed decisions. Well, Mr. Guha got upset about this term, empowered, and wrote with reference to Aetna's chief executive, he might be here, but anyway, Mark Bertolini. And he said this, the young man, that's so sweet you want me to be empowered. Does @MT Bert care to empower me by paying my $118,000 bill? Guess what happened? Mr. Bortolini joined the Twitter fray. He responded on his Twitter account We've paid hundreds of thousands of money already. A call is all it takes. The young man responded, does that mean if I call you, you'll graciously offer to pay my bills? Response from Mr. Bertolini. Do you think it's morally justifiable to offer the flawed insurance product that doesn't cover catastrophes? That's what the young man said. And Mr. Bertolini responded, why do you think the premiums were so low? Don't you look at your policy limits when you buy other insurance, like auto? And then the young man responds, and before long, other people joined us, of course. I'm concerned that you don't understand how your industry works. ASU students aren't given a choice on insurance plans. And on it went, back and forth. And finally, someone said, nobody's asking you to cover the uninsured, we're asking you to cover your members. And Mr. Bertolini responds, the system is broken. I'm trying to fix it. By the end of this story, I won't belabor it, Mr. Bertolini and Aetna paid the $118,000, and we know that by now, of course, with the Affordable Care Act, these things don't happen when people are kicked off if they get really sick and need that kind of coverage, including students. You know, that's what we need. Bold action on the part of those who can make a change in this crazy, sometimes mixed up system. But notice how it took the bold action of the sick to make this happen, using, in this case, his savvy with social media. What about those who are too sick to act for themselves, for to whom quick action of technology is just not available to them? By the way, by the end of the story, the young man says, I want to get into healthcare work and help fix this system. And I was thinking, Francis, you ought to go find him and hire him. We need young people like this to show us the way so that we can preempt these troubles by taking careful, bold, deliberate action now in anticipation of catastrophes like these in the future. A final story comes from the first century AD religious movement known then as the Jesus movement. The story goes that Jesus, a Jewish preacher, healer, and social justice advocate, was walking with the crowds that followed him everywhere when a woman with a serious hemorrhaging illness, who was considered an outcast because of her condition, was destitute after spending so much money with doctors of the day with no solutions. She reaches out and touches the healer, breaking all kinds of social rules. Miraculously, her ailment was gone, and Jesus feels that something special has happened. However, he has been approached by a rich ruler to come to his house and heal his 12-year-old daughter. So he's on his way to visit this very sick little girl, this daughter of a well-known community leader. But he stops to attend to this poor woman who's been sick for 12 years. And in doing so, the daughter of the well-to-do man, who is 12 years old, reaches the end of her battle with her illness. And as far as everyone concerned, it was too late. She had passed away. There would be no health care that would bring her back. However, Jesus insists on seeing her. And when he finally arrives, what seems too late was not. He heals her too and brings her back from the brink. Now, stories like these in the gospel traditions are parabolic. They mean to teach us something beyond the details of the story itself. And I thought about this story in preparing for today. We have a situation, or Jesus had a situation back then, where two women, one old, one young, one poor and an outcast, one more affluent, yet worthy of excellent, attentive health care by this traveling healer. One had been 12 years sick, another was just 12 years old. Jesus determined that healing should be made available to both. And he teaches that to his followers. It's a foundational principle in healthcare. All have a right, regardless of social status, to the medical attention needed. The two stories in the gospel tradition are juxtaposed, one inside the other, to make that point even greater. And it's the complexity and ethics of the matter. Should Jesus have let this woman, after all, she was old and outcast, she didn't have the resources, she had left her and gone to attend this young, vibrant little girl who was on her deathbed? He did both. And today we ask ourselves that regardless of the complexity of these matters, regardless of the social distinctions that exist in our society, both merit attention. Both can and should be attended. Both merit excellent health care. And this is what we look for in bold action toward excellent health and healthcare systems. Equal time, equal justice, regardless of thought. So if you were to ask me, Dr. Agosto, you're not a medical doctor, so you don't know that much about medicine or health. But can you leave us with some principles? Yes, I would like to, if I may. First, simplify and clarify. I know, it's easier said than done. But if the matters of health and healthcare are complicated for those of us in this room, we know that they are. Imagine what they're like for the average person who only wants to know that when they get sick, they can be treated quickly and efficiently without growing broke in the meantime. How can we make it simple for the sick so they don't have to worry about questions like, are you in my network? Second, let's do the right thing now and not wait till the person gets sick later. Let us plan for contingencies. The doctoral student who thinks that a young doctoral student will get cancer, well, bad health could happen to anyone. And Aetna, United, Anthem, Blue Cross, they all should plan for the worst and anything in between and take care of their members without having to resort necessarily to tweeter pressure. We need bold action, creative thinking, like the kind that resides in this room, and we need it now to prevent disaster tomorrow. Thirdly, let's make it equal. Everyone deserves to be healthy, and everyone deserves the best care, both because it's the right thing to do and because all society benefits when the poor woman is attended to and the rich man as well. Both can contribute to society, and both can be healed if we make a commitment to them both. To conclude, as a baseball historian, I read the wonderful stories surrounding the late great Yogi Berra, I ran across this one. Let me read it to you. I feel privileged to have grown up in a few blocks from Yogi's house in Montclair, New Jersey, and had the even greater privilege of being the personal recipient of a yogiism when I was a boy. While I was playing at a friend's house, my toy rocket arched over Stonebridge Road and landed in the bushes in Yogi's yard. As I was searching through the brush, a voice gruffly asked what I was doing. When I explained, Yogi looked me over and said, well, when you see it, you'll know you found it. And he walked off. Those words have resonated with me for almost 50 years. Because on a much higher level, people struggle to define just what it is that they're looking for in personal and challenging areas like joy, faith, and love, and I would add, and healthcare. But let's face it, when you see it, you know you found it. And I ask you all of us, knowing that there are no easy roads for the work before us, so much to do, so much resistance, and so many corners. But if we commit to the principles of simplicity, justice, and equity in health and healthcare, when you see it, you know you found it. And finally, I read recently the following words. The future is already here. It's just not evenly distributed yet. Could you, my friends, envision a future where excellent, not just good, but excellent health and healthcare in all its complex dimensions, but worked out by committed, knowledgeable, patient, skilled people like those in this room today? A future that is already here in many of these matters, in affordability, in accessibility, in quality. It's already here, but just not equally distributed. Can you see the future boldly before us, where it is just that, evenly distributed for all? I think we can spark bold action for health and healthcare this day and every day, and do the right thing for all. Thank you very much.